Hi, I am contestant number 1023-4. Today I will be demonstrating subcutaneous injections. Many will ask, what are subcutaneous injections, otherwise known as SQ or sub-Q injections? It is a way of giving a drug, medication, and/or vaccine. Overall, subcutaneous means being under the skin, typically given into the tissue layer of the skin and muscle. Aside from other injections, sub-Q injections are the slowest way of giving a medication or vaccine. It does take up to 24 hours for the vaccine or medication to be absorbed in the bloodstream. Although it takes longer for a medication or vaccine to be absorbed in the bloodstream, it is highly effective. Where are subcutaneous injections given? They are normally given in the following areas: upper area of the arm, normally known as the fatty part, the inner thigh, upper outer area of the buttocks, upper hip, as well as the abdomen with some exceptions, those areas being a few. Some important information about the needle is that it is a short needle, 5/8 to 1 inch long. The gauge size is about 23 to 27 gauge. The minimum amount of fluid given is 0.5 milliliters and the maximum amount being 2 milliliters. Sub-Q injections are given at a 45 or 90-degree angle. It is most common to be used at a 90-degree angle. When giving it at a 90-degree angle, you grab 2 inches of the skin between your thumb and first finger, like this. The only reason it is given at a 45-degree angle is if you are unable to grasp 2 inches of skin. It is important to give it at a 90-degree angle to make sure that the vaccine or medication is given into the subcutaneous tissue. Subcutaneous injections range from gauge size 23 to 27. Here I have gauge size 23. Here I have gauge size 25. Here I have gauge size 27. And here I have the insulin needle. What sets subcutaneous injections apart from other injections is the fact that it takes up to 24 hours for the medication or vaccine to get absorbed into the bloodstream, example being intramuscular injections and IVs. They're used when they want the medication to be absorbed in the bloodstream faster. Yet again, the major and most known difference is the speed. Some types of medications and vaccines that are given with subcutaneous injections are fertility drugs, insulin, blood thinners, measles vaccine, otherwise known as MMR, as well as varicella vaccine, also known as chickenpox vaccine. I will now demonstrate how to properly give an insulin injection to a patient. We will first start with washing our hands, but for this occasion, I will be using gel. We'll make sure to wash our hands very well for at least 20 seconds. I will now be donning my gloves. Will now proceed to grab the amount of insulin needed. I will be grabbing an alcohol prep pad and make sure to clean the babble. I will now grab the needle and carefully insert it at the top of the babble. I will then now turn it upside down and pull back as many units as needed. I will be getting 5 units for this example. I will now carefully recap. Now that we have our insulin, I will go ahead and prep our patient. I will grab an alcohol prep pad and make sure to disinfect the area where I will be inserting the needle. I will now grab 2 inches of skin within my thumb and first finger, but we will now grab our needle as well as 2 inches of skin. I will insert it at a 90-degree angle and make sure to recap correctly. Now that we have properly given our patient their insulin, I will be disposing the insulin needle in a container like this. I will now be doffing my gloves. And at this moment, I will dispose of everything to the trash can. Now that I have properly disposed of everything, I will go ahead and use this time to wash my hands. But for this occasion, I will be using hand gel. Thank you.